Well, official figures from Italy offer a glimmer of hope that lockdown measures introduced 2 weeks ago have slowed the spread of the virus. The registered death toll has dropped for a second consecutive day, as has the number of new confirmed infections. The crisis has pushed northern Italy's health system to the breaking point, with critical care units filled to capacity. Unions in the worst affected region, Lombardy, are demanding even tougher shutdown measures to protect health workers. Many factories are still operating in the region, though the government says they are essential for the economy. And for more on this story, we can speak to Pierpaolo Sileri in Rome. He is the Deputy Health Minister in the Italian government. Mr. Sileri, thank you for joining us here on DW. I want to ask you about this report that Italy has now seen a drop in daily deaths and infections for the second day in a row. Do you think that the worst could be over?
I don't know if the worst is over. No doubt that there is a decrease of the number of the infection, and this is due to the restrictions that were made between the 8th and the 9th of March, and then the day after with the lockdown of the entire Italy. This means that probably we will see a decrease over the next few days. I believe that probably those 2 days, yesterday, the day before yesterday, and probably today, we will see this drop, and hopefully it will be like this for the next few days. But when it's going to end, this is very difficult to predict right now. Probably we need 10, 15 more days to be sure that everything is over.
Okay, so there's some progress, but you have to wait and see how things develop. At the same time, I want to ask you about some news that we saw today coming out of Bergamo, where a mayor told press there that actually the death toll in that region could be something like 4 times higher than the original figure, because there are a lot of people who have died outside of the hospital without being tested. So is that true? I mean, what can you tell us about that?
I believe that the heat that was in the Bergamo area is due mainly to the fact that it's a very, very active industrial area with a lot of movements from the other regions in Lombardia, the south part of the Lombardia, where there was the beginning of these outbreaks. And probably this very high number reflects the high number of infection that probably we didn't detect because swabs were not performed to everyone. So I believe the number of infected people that they don't know to get the infection, even because we know that 80% of the infection are without any symptoms. So probably the number are even higher of who was infected.
Mr. Sileri, we've been looking at some pictures of hospitals. What is the situation like right now for healthcare workers who say that they have been overwhelmed by this crisis?
But you can see that in Lombardia the health system was under stress, but responded very well. Now in Italy we have an increase of the ICU bed by 60%. So we passed from 5,000 beds to more than 8,000. We are giving personnel and technology to fight this war against the coronavirus.
Mr. Sileri, what is your advice to other countries, also here in Europe, from your experience there in Italy?
2 things should be done. The first is the lockdown. I mean, you need to avoid people to go around. So you need to close whatever you can close, basically, because if you stay at home, there is no possibility to pass the virus to somebody else. And the other thing is increase, obviously, the number of beds for ICU and infectious disease ward and lung disease ward. Increase the number of doctors and increase the ICU beds. I believe is the most important thing. The other thing is I believe that people who have symptoms, they should be admitted in the hospital if they are severe or less severe. But even if they have small symptoms, they should be controlled in the territory, with doctors, because this is a very bad disease. Because you are okay for a few days, you got just fever and then some cough, and then suddenly you may have lung disease with pneumonia. You may die in a few hours.
Okay, Pierpaolo Sileri, the Deputy Health Minister in the Italian government. Thank you so much for joining us here on DW.
Thank you. Thank you.
Now, in Spain, the government is expected to extend the state of emergency by 2 weeks. The number of new coronavirus cases jumped by some 6,600 overnight, with more than 500 reported to have died. Pictures taken at a hospital in Madrid show patients lying unattended in a hallway. The Spanish capital has been particularly affected with nearly 10,000 cases. An ice rink inside a shopping mall in Madrid has been turned into a makeshift morgue. And soldiers helping to fight the virus have made shocking discoveries at nursing homes where elderly residents have been found abandoned, some dead in their beds. Prosecutors have launched an investigation. And let's go to DW reporter Jan-Philipp Scholz. He's standing by in Seville. Hi, Jan-Philipp. This is a grim discovery at these nursing homes. What more can you tell us about the situation?
The Spanish defense minister said that soldiers were disinfecting residencies when they witnessed those traumatizing scenes. People suffocating, people abandoned, people even dead in their own beds. Prosecutors have already started an investigation now. But there are also statements of nurses saying the allegations are not very fair. They have just done their job and they've actually followed protocol because they have to leave the dead bodies in their beds until the funeral services arrive. And this can take more than 1 day at the moment. And they also say that they're at the front line of the outbreak and they are not even well protected themselves. And exactly this problem, that medical personnel is not well protected, also reflects in the newest numbers. More than 5,000 health workers have been infected in Spain. This is about 15% of the entire people that are infected. I think we have to be careful with the percentage because it also could mean that health personnel just gets tested more often and there are actually more people infected in the whole country, but the numbers are disturbing.
Well, we do know that health services say they are being overwhelmed and Spain is taking drastic measures. Is there any sign that these measures are helping the situation?
At the moment, it's probably too early to say anything about that. There is no clear trend, although Mr. Fernando Simón, who is the head of the coordinating center of the health ministry, said that he has some hope that the peak might be reached in the coming days, but I think most experts agree that it's too early for a clear trend. And also Prime Minister Sanchez has warned the citizens that the worst is yet to come in the coming days. This is also reflected by a very symbolic example. A makeshift mortuary is set up in the city center of Madrid, in an ice skating center that has Olympic dimensions. And I have heard that the first coffins have already arrived there.
And Jan-Philipp, Spanish authorities are now actually enforcing social distancing measures. This is all trying to stop the spread of the virus. Are people cooperating?
Yes, they are. They are amazingly disciplined in this. I was on the streets yesterday to produce some news reports, and there is literally nobody on the streets except for some policemen. And we have to keep in mind that the measures here in Spain are much stricter than in many other countries. You can't even go out for a walk, or you can't even go to the park with your partner or your child.
All right, DW's Jan-Philipp Scholz reporting there for us from Seville. Thank you very much. Now, here are some of the latest developments in the coronavirus pandemic. Indian Prime Minister Narendra Modi has announced a nationwide lockdown. Beginning at midnight, some 1.3 billion people will be barred from leaving their homes for 21 days. Here in Germany, 95% of people say they support the government's ban on gatherings of more than 2 people. That's according to a new poll. Meanwhile, some 6 million protective masks that were destined for Germany have gone missing at an airport in Kenya. A German firm had produced the masks, and it's unclear why they were in Kenya to begin with. And the World Health Organization is warning about a big acceleration in case numbers in the United States. It says the U.S. could become the new epicenter of the global pandemic. The Tokyo Olympics in July will be delayed by about a year because of the coronavirus. Japanese Prime Minister Shinzo Abe says he's agreed 100% with the president of the International Olympic Committee that the Games should be postponed. The decision follows months of debate and pressure from athletes across the globe.
When Tokyo was awarded the Games back in 2013, the coronavirus was just a dystopian nightmare. Fast forward 7 years, and the pandemic has gripped the globe. At first, the Japanese government and the International Olympic Committee insisted the show must go on, but doubts about the Games starting on July 24 began to rise. Athletes such as Greek pole vaulter Katerina Stefanidi made it clear they were uncomfortable with training for the 2020 event, let alone competing in it. Canada and Australia then effectively boycotted a 2020 Games. It all left Tokyo organisers and the IOC with little choice. A cancellation was out of the question, with the cost of the Games already in excess of $12 billion. A scaled-down version appealed to no one. A postponement became the only option.
Mark Meadows from DW Sports is covering this story for us. Mark, tell us the latest about this decision to postpone.
Yes, well, Japanese Prime Minister Shinzo Abe has just told reporters that he's basically had a telephone conference with the IOC boss, Thomas Bach, and we asked President Bach, he says, to consider postponement of about a year to make it possible for athletes to take part in the best situation and to make the event a safe and secure one for spectators. President Bach said he is 100% in agreement. And we've also heard from the IOC now officially that the Games are postponed. We don't actually have a set date yet, but it's going to be round about a year. Now, Tokyo's governor and Japan's Olympics minister have said basically it will not happen any later than August 2021.
It seems like this really was just a matter of time, Mark.
Yes, I mean, there was so much pressure on the IOC. It's amazing how quickly it's gone. It was actually only Sunday that the IOC first mooted the idea of a postponement. Then yesterday, on Monday, Shinzo Abe mentioned it for the first time. He said it was possibly inevitable. And then suddenly on Tuesday, we have a decision. The IOC on Sunday had actually given themselves 4 weeks to make a decision. In fact, the decision has come in just 2 days. That shows how much pressure there was. You had Canada saying they're not going to send a team. You had Australia saying something similar, and many other nations as well. There was just no way in the current situation the Olympics could happen in 2020.
Despite that, it's definitely a disappointment for Japan, for all the athletes who are hoping to take part. So we're looking at about a year from now. Can these Games still be a success?
I mean, if any country can pull it off, Japan can. I mean, it will be so organised. They had all their venues ready months and months before. It's not always been the case in previous Olympics. So they can. They've got obviously all the volunteers ready. I'm sure they'd be willing to come back in 2021 instead. But the big question mark is if this pandemic continues at the pace it's been going at, if we're in this situation still in December, then they might be thinking, well, hang on, maybe July and August next year is too early. So there's a lot of question marks, but maybe in the coming days we will actually get a specific timeline for when these Games are going to take place. The IOC are going to have an executive board meeting later today, so we might hear a little bit more.
All right, Mark Meadows from DW Sports reporting for us. Mark, thank you very much.